Welcome, welcome. Today we have with us Kaitlyn Pelliter. She's the owner and nurse practitioner for Wasatch NP House Calls. Thanks for being with us today. And today the purpose of our video is really to learn a little bit more about house calls and what Kaitlyn's business is. So yeah, let's just get right into it.
Great.
So the first question is, what inspired you to start Wasatch NP House Calls? And how did your background in geriatrics influence this decision?
Yeah, so my background in geriatrics is what got me to start this business. Being a geriatric nurse practitioner, my sole career is caring for the older adult, and it is very apparent at some point in our aging process that we all need more help. A lot of my patients who would come to a clinic are struggling to get to that clinic. We all stop driving at some point, and it's harder to get there. We have limited social support and family in the area to help us navigate the healthcare world. So the need was very apparent just by working with the population. And then I said, let's do it.
That's very cool. I love that. And then what gaps in senior healthcare did you notice that led to create this service? I guess you kind of touched on that a little bit.
So the biggest gaps would be the difficulties of navigating a healthcare system as an older adult. If you think about navigating your own health, you've got to keep up with your medications. You've got to make an appointment. You've got to know how to technologically make that appointment. You've got to then drive yourself there. We live in a snowy place. What if it's snowing on the day that you have to go? And it's a lot of logistical things that become daunting to the older adult. So the gaps where we can make this better, and house calls is one way to do that.
That's awesome. That's cool. So what types of service do you offer through Wasatch NP House Calls?
So I do pretty much personalized care is the best way to put it. Personalized comprehensive care. Some patients may need a primary care provider.
Okay.
Some patients may have a primary care provider, but they need another member of their team helping them to manage their complex medical conditions. And we call that palliative care. So primary palliative care services in the home that breaks down into medication management, medical condition, symptom management, care coordination between a quarterback of your medical team and all of your specialists. And I would say many other things. Ultimately, the best thing I can do is get in your home and see what kind of services you need.
That's cool. And then just go from there.
Yeah.
That's awesome.
Yeah.
I like that. How does mobile health care improve patient outcomes compared to traditional office visits?
Yeah, this is my favorite part of house calls.
Sure.
Office visits are wonderful. We have used them for many decades, but they are not personalized. So house calls allows me to go into your home and see if you have fall hazards all over your home. It allows me to lay my eyes on your medications and go through each one with you instead of you coming into the office and saying, I don't remember that medication specifically. The personalization of it helps us to optimize your health and keep you safer and at home longer. And that's the ultimate goal.
That's cool. I like that a lot. And then how do you coordinate care with other healthcare providers such as specialists, home health, and hospice?
Yeah, that's a large piece of house calls and just the older adult in general. It's not one size fits all because everyone uses different technology systems. And we don't necessarily communicate in the medical world as well as we would all like us to. So I try very hard to piece together our different specialties. So I will send my notes to the outside providers. I will make a personal call. I will send an email, all in an effort to have kind of a multidisciplinary approach to the patient and get everyone on the same page. it takes a lot of footwork in
Dang.
a lot of cases.
Yeah, no, that sounds pretty intense actually.
Yeah.
And then what feedback have you received from patients and families about your service?
They love it. Family members love it because it takes a concern off of their shoulders of having to take off work and get their loved one to the office, or they want someone who has closer eyes on them. Typically, you see your primary care twice a year, maybe, and that's just not enough for most aging adults. So when I can get into the home more frequently, that also optimizes their care and keeps them safe, and family members just feel like their loved ones are taken care of better. Patients tend to say that the convenience of it and the comprehensive nature of it is unbeatable. They love that you're in their home and you're addressing every one of their needs, no matter how much time it takes. You don't have them on a timer saying, oh, that's enough time for today, and you get to address everything.
That's awesome.
Yeah.
That's great. And then how do you see mobile healthcare evolving in the future, especially for aging populations?
Yeah. So house calls, mobile healthcare used to be how we did most of our primary care care management in like the 30s and 40s before we went to organization-based care. And I think it will be coming back. I'm trying to bring it back.
That's good.
Because especially in more rural areas, and we have a lot of rural areas in Utah, people are aging in place. They don't want to leave their home, or even if they did and they wanted to go to an assisted living or something, there's not any. So they have to age in place, and they need more resources in their home to help them safely and comfortably do that. So I think it was a thing of the past, and it's now a thing of the future.
That's cool. And I feel like Utah's perfect for it just for the weather reason. Like
Yeah.
these winters are pretty harsh.
Yep.
And you don't want your loved one like walking on their icy driveway.
Nope, to try to get to their car and drive in a blizzard up a canyon. And yeah, totally very necessary in the area that we live in.
That's cool. If someone is interested in your services for themselves or for a loved one, how can they get it all started?
Yeah, so Wasatch NP House Calls, you can Google, and there's a website that you can go to, and you can send me a message on the website, or the telephone number is listed on there. I'll also list it on the posting on the Instagram.
Totally.
And leave the information there. And ultimately, you give us a call and say you're interested in the services. We check your insurance plan and make sure it's covered. All of the services are covered under insurance, or else we don't make you pay out of pocket. And then we get you scheduled for an appointment.
Sweet. That's awesome.
Yeah.
Well, thanks, Kaitlyn. Thanks for chatting with us.
Yeah, thank you.
Awesome. Golden.